Hello, Cam followers. It is Thursday. It is 7:30. I have got the wonderful Dr. Michele Broadhurst here today because we're going to be talking about other areas of where pain of OA and dysfunction of OA, osteoarthritis, comes from. And this is definitely one of the world experts in the topic. So I'm sure that you're going to be blown away. But first of all, I want to say a massive thank you to our main sponsor, Big Barker Beds, based over in the US. Hugely grateful for their support. I'm proud to be associated with them because they are, as far as I'm aware, the only dog bed company in the world that has put their bed for a clinical trial so they can actually market it legitimately as a dog bed that offers benefit with regards to pain, mobility, comfort, etc. So the clinical trial was done at the University of Pennsylvania. I saw the bill. It's incredible. Hats off to Big Barker for doing this. But I will say, it's something else when you actually take a product and put it through a clinical trial to prove that your marketing is legitimate. So well done, Big Barker. High five to you. And thank you so much for working with us. Back to Michele. Dun, 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 dun. I adore this lady. So we're going to have so much fun. She's a huge inspiration. And I met her through her amazing book that came out probably 2 years ago.
Yeah, it's just about to be it's actually about to be re-released as a new edition with a whole bunch of other stuff. So I'll have to send you one.
Oh my God. Shall I go and grab it? 2 seconds. Let me go and grab it. I have it here. Always at hand, under my pillow.
In your spare time, Han.
Well, I will put a link into the feed so that if people would like to get access. When's the new one come out?
Probably in the next 2 weeks.
Okay. We will pause and we will make sure we link to the new one. Good job.
Cool.
Okay, so this is hugely important, guys. This is a really, really important live because there is a very big belief that the pain of arthritis, as we see it, is from within the joint. And I'm going to break it to you very harshly that is not true. And this lady is going to come and explain it to us because what's great about this is she's going to open a gateway for all of you to start modifying your dog's pain state and their functional capability. This is within your grip. And it doesn't mean that you've got to spend loads more money, which I feel I'm really passionate about. I'll just very briefly. I'm from a family that had a dog, and we've had dogs throughout our lives, but we couldn't afford insurance. It was a low income family. My mum and dad brought up 4 kids on a very meager wage. Didn't mean we didn't love our dog, but we would have never been able to pursue laser, and we would have never been able to do stem cells, and we would have never been able to do all of this. But we loved our dog as much as anybody else. And these sorts of interventions that you're going to talk about would have been applicable to us. And that's what's really important to me. So tell us a bit about yourself and then we can crack on.
I'm originally South African, so I have a bit of a weird accent compared to everybody else. And I've been in the US for about 4 years now. And I'm a chiropractor, an acupuncturist, a chiropractic sports physician, and I have a certification in animal rehabilitation or physical therapy, whatever you want to call it. I've been doing this for about 20 years and, having a history in chiropractic. And thankfully, I was a student in South Africa where they treated a lot more almost osteopathically. So looking at functional and structural stuff, not just structure alone. So it's kind of been inbred with me for my whole life. So when I got into the animal world 20 years ago, I brought this very much with me. And so it's something that I'm super passionate about because veterinary is a little bit behind medicine for humans in the way that we approach things. So it's very exciting to kind of bring the functional element to the forefront of veterinary because it's something that we ignore a lot in the veterinary world.
Definitely. I think Let's start really, really simple, because a lot of followers will go, I don't understand the difference between chiropractic and osteopathic. And their terminology that often gets swapped over, bounced back and forth. Just let's start the game by clarifying what is the difference between those two disciplines.
Well, from a purely hands-on approach, chiropractic is a short lever technique. So it's very specific. It adjusts like one joint. And obviously, joint and nervous system is very much interlinked. From an osteopathic standpoint, they look a lot more at long lever techniques, which means they're much bigger movements. They're not as specific as a short lever movement. So it's like a short little adjustment is chiropractic. Osteopathic is almost like a longer movement. But osteopaths have a tendency of looking at things, at least in their primary education, looking at things a little bit more functionally. Like, for example, and so do chiropractors. It's changed a little bit, but basically kind of going, okay, so how does this vertebrae, how does this neurological pathway affect everything else in the body? Mm-hmm. And then really kind of spreading out from there and working on an organic level or a muscular or a ligamentous level to change how things are performing at that neurological pathway.
Okay, there you go, guys. Because I think it is quite confusing, and it is confusing in the animal sector, because we do have veterinary chiropractics and veterinary osteopaths, and I think a lot of people never really know which direction to go in. Right, let's start right at the beginning. So osteoarthritis, also known as arthritis for short, or degenerative joint disease, or arthrosis, there's so many different names, is always going to bring everybody's brain straight to the joint. So an owner will come back from seeing the vet and go, he's got hip arthritis, mm-hmm. or he's got knee arthritis, or he's got arthritis in his shoulders. And everybody then goes, yeah, I'm going to only think about that joint. Mm-hmm. Now, let's talk about what that does to the joint, the limb, the body, the whole animal, so that people can understand that you can actually influence shoulder arthritis by massaging the lower lumbar, believe it or not. So please help us understand that.
Okay, so in order to really, really understand the pain and the inflammation that arthritis brings, we have to understand the nervous system a little bit more, okay? Mm-hmm. So I'm going to make this as simple as I possibly can. So there's something called the central nervous system, which is made up only of the brain and the spinal cord. So it's the central database, if you would, okay? Everything else beyond that is called the peripheral nervous system. So all the other nerves and all the other pathways that go on in the body, that's all your peripheral nervous system. So anytime that the body is going to be damaged by disease or injury, or any tissue is going to be affected, there's this release of chemicals that happens in the nerves, okay? And so these nerve pathways go all the way up the spinal cord via a sensory nerve, and they get taken via different little neurons to a place called the thalamus, which is in the brain, okay? So, and then what happens in the brain is really, really cool, because what the brain does is it goes, holy cow, this isn't good. We need to try to figure out what's going on here. But one of the big things that happens in these pathways is that there are different portions of the brain that have different jobs. And so we have these three very fancy pathways called the spinothalamic, the paleospinothalamic, and the spinothalamic pathway. It's lunchtime here, so I promise I haven't drunk anything yet. And each one of these pathways have a certain job. And so two of these, the raccospinothalamic and the paleospinothalamic, are very interesting because they're portions of the brain that interpret emotion and reactions to emotion. Now, if you have chronic pain for a long period of time, or even acute pain for longer than a day or two, you get really sad and you get depressed, and you change the way that you act and you move and you feel about life. And this is exactly the same in animals. Is that when they start to hurt, and they start to hurt all the time, they have depression, their mood changes, the way they act changes. And so what happens is once the brain is being inundated with all these pathways and all the stimulus, is it changes how everything is going to work on a reactivity level.
Mm-hmm.
Does that make sense?
Yes, I'm with you.
So the dog's getting all this input because things aren't cool and things aren't going well. So
say he's got hip arthritis, bilateral hip arthritis. Those hips are
so the hips are angry.
Weight bearing, a little bit of a weight shift. Every single movement is sending signals up those pathways to that brain. Yeah.
Mm-hmm. And so the brain is going, how do I deal with this? How am I going to manage this? Because the brain is the most fantastic micromanager. It takes all these stimulus that we give them and it changes it into a reaction. Okay.
Mm-hmm.
So the central nervous system goes, oh, things aren't going well in those hips. How are we going to manage this so that Fluffy can still get around as he needs to? So what happens is that we have these, what we call a descending pain pathway. So all these signals have gone up. Now a signal has to go back down. And how the brain is so incredible is that it starts to try to find ways of dampening down this neural transmission. So it's almost like playing broken telephone. If you're my age, you used to get cups and a piece of string. Yes. And you would start with like 5 of your mates saying something, and on the other end of the telephone, it would be a completely different message. It's a little bit like whispering in people's ear, and it comes out completely wrong.
Yeah,
that's what the brain does, and it's so clever in the way it does that. So what it does is it has all these mediating things. So it sends these beautiful hormones like your serotonin and your dopamine and your endorphins. You know, we all know about endorphins when you go for a 1 kilometer run, and and then you feel so good about yourself, right? No, but genuinely, this is what happens: is the body interprets this totally different. So it sends all this cool chemical stuff to dampen these pathways, so that the pain response that is being interpreted in the brain is dampened down by the time it gets down to those peripheral nerves that have to allow those dogs to move accordingly.
Mm-hmm. Because we need to move to live. So this is like one of these most incredible kind of archaic abilities in us, that to survive, we need to move. So that exists to enable us, even when pain is being created, to override it, to continue to move.
Right. And so when you have arthritis for a long period of time, all those nerve cells in your brain and your spinal cord, they actually can change over time. Mm-hmm. So they become chronic. And so we get what starts to happen is the body's ability to moderate this pain and change it and dampen it down becomes a little bit, it gets a little tired. Mm. So this is when we start to see things such as compensation. So the dog can't actually compensate anymore in that area, like in the hip and in the butt and in the legs around that hip joint. It can't compensate as well as it did. So it starts to fail a little bit. So what happens then is that the body is going to take another approach and shift that job somewhere else. Mm-hmm. And with that shifting, we're kind of like passing the buck a little bit, because we're passing on the dysfunction to another portion of the body. Mm. And so this chronic kind of inflammatory process ends up with something called central inhibition and sensitization, really, where things don't do their job as well as they should. So we start to see this breakdown, but also what starts to happen at the same time is that the perception of pain, because it can't get dampened as well as it used to, starts becoming a little bit more heightened. So then any time that you even almost go towards that back hip, the dog's going to start quivering and get weaker and want to sit down, because it knows the pain response that his body's going to give.
Yeah. I think I was blown away, like, because I'm on a very steep learning journey. The last 8 years has been, but we don't, as vets, get to talk about things like reflex inhibition. So when there is pain somewhere, it's very hard to voluntarily override it. So if you have pain in your hips, even if you're going to go, right, I'm going to be really strong today, I'm just going to walk through this. Your body's going, no, you're not, mate. This is a reflex. So you got no choice. I am going to guard whether you like it or not. And I was like, oh my God. And so if you think about it, if your body's in that protective mode and it's reflexively guarding and it changes movement and capacity to move, that function, that request has got to go elsewhere, hasn't it? So even if you've got the most, motivated soul of I can walk through these bad hips, you're still going to have body going, ain't gonna have enough. And you're going to have to change. You're going to start moving from your lower back, can't you? You're going to have to really kind of drive. And then that area of the body, the only way I can explain it, was never designed to do that. And it can for a while. Like, I'm still amazed at how amazing bodies are. Kidney capacity, liver capacity, heart capacity, nervous system regeneration, muscle capacity. We have got so much leeway in our body, but eventually goes, nah, you burnt me out, mate. I haven't got nothing left. You've been asking too much of me. And then you start getting these other areas of problem. Is that?
Well, and that's the whole thing, right? So when you have arthritis in a joint and you have all these pro-inflammatory markers, which we love to call them that, but basically we have inflammation, and the joint is really angry. So it's sending off all these signals, right, to the brain. What happens is the brain goes, I need to protect that as much as I possibly can. So what it does is it goes into a lockdown mode, right? Where it tells all the muscles, hey guys, this joint is like super dodgy. You need to look after it. So everything just starts overworking and overworking and overworking. And there's something I talk about a lot, which is the Cinderella hypothesis, right? So we have this dodgy hips. Now this hip can't extend anymore. So we're not able to bring that leg backwards because it can't move properly in that joint. So we start losing the most important muscles around that area because they don't work anymore. So they don't do their job. So every single muscle has got a job. And if we don't allow it to do that job, or the body won't allow it to do that job, we start losing stability in that area. So for those of you with a dog with hip arthritis, normally they're okay till a certain, time in their life, and then we start to see a rapid decline, unless they're unfortunate to have a really high grade osteoarthritic change or hip dysplasia that they have from babies. But for the most part, they at some point have a little bit of a Beyonce butt, right? And what starts to happen is they end up losing that beautiful round rump that they used to have, because that muscle, which is your glute medius muscle, no longer can actually extend that hip, and neither can the hamstrings. So we end up with these flabby hamstrings and this runner's bum, okay, which looks more like Twiggy than Beyonce.
Yeah, I call them like the back bingo wings.
Yes, exactly. Right. And they kind of not, so that's when the dogs start to get this little sway, right? And they start to have their legs kind of crossing over, because we've lost the functionality of the muscle, because the muscle is working 24/7 to just try to protect that hip, but it's not able to grow and thrive because we can't give the muscle the movement that it needs to actually grow and continue being strong in that position.
Yeah, absolutely. And I think this gives us a really good short tangent to bounce back, is that we've just talked about some visuals that people can immediately go away and go, has my dog got back bingo wings? Has my dog got no beef tomato? Has my dog got some really big saddlebags in its lumbar? What's going on? Does it crisscross? Is it really tight on the inner thigh? And guys, if I can do this, you can do this. I started my little journey into Michelle's world only, I don't know, 13 years ago. I don't even know when it was. And I didn't get taught it at vet school, but you suddenly go, oh my God, this is really, you can see and you can feel this. And I often say to people, in the wing of ilium, so over the pelvis, you have these beef tomatoes. And then you sort of go, whoa, they're not very beef anymore. They're flattening out, And you look at the quads and the hamstrings. They're like, rah, beautiful vase. You're like, oh, there's no vase on one side. And then you put your hands on the inside and you go, that muscle does not feel like that muscle. That's not balanced. That's really tight on the inside and it's really nothing there on the outside. If I can do it, you guys can do it. So.
And you know, one of the other thing that happens is if you've got no engine in the back end, you try to create an engine in the front end. So for those that are my age, you'll remember the old Forksies, the little Beetles that had their engine in the front, right? Because there was nothing in the back. And that is what so many of our hind end or our pelvic limb dogs look like. They almost look like Madonna from the 90s videos, right? Like these ginormous pecs and these big and over kind of developed triceps in the back end. And, you know, some of the things that you'll notice is that they no longer move like a gazelle. Instead, they look like the pistons in your car, where they're going up and down and up and down and up and down. They lose that stride length because the muscles are working so hard to keep those angry joints from getting more angry, and they can't go in the movement that they used to do. And now those muscles get tighter and tighter and tighter. And instead of helping, they end up impinging that movement even further. So that you know, that compression of that muscle makes those little pain receptors and those little mechanoreceptors start having like a huge tequila party where they're just going crazy and sending all these pain signals up to the brain, and the brain's going, I can't give you guys all coffee. Like, you all need to just chill out on your own. I can't do this for you. So it becomes very overwhelming. And that's when the nervous system starts to almost fall apart. And we start to see cognitive changes in our dogs. And by cognitive, I mean, we start seeing them sleep a whole bunch more. They don't look happy. You know, and they can be on all the drugs in the world, but they have so many systems that are trying to kind of work complexly together and are failing, that we start to have all of these reactions.
Yeah, definitely. And so cognitive, guys, is like the ability to think. So you've got kind of like, let's keep it really simple because I've got a simple brain. So you've got your emotional states, you know, that's how you feel about things. And cognitive means how you think about things. And I can remember my dear friend Gwen, who's got macho pain, and she was telling me that she gets cognitive fogging. And there's days where her nervous system, because of the amount of pain and pain signals from different regions, is coming up to her brain, and her brain goes, I'm busy. I ain't going to choose a coffee for you today because I am busy, and I don't know where the gear stick is anymore. I don't know which gear I'm in because I'm busy. And she says, you know, it really does affect her ability to think, plan, you know. And we all know that pain can really affect your emotional state. So let's kind of like recap. So we know that the joint creates pain, signals up to the brain, and initially the brain has the ability to try and keep it in check, but unfortunately over time it loses that ability to keep it in check. So we end up getting a magnified signal. So we almost get the pain from that joint budding away from the actual disease process. And we have almost more pain being perceived than should have been truly created. But we also have changes in and around the joint and compensations because of lack of function and the unwillingness to use. So other parts of the body are beginning to start tightening up and changing, and they too start becoming a bit angry, and they start sending signals of pain to the brain. And that's what we're saying about that causes suffering. So once you get to the point where you have got so many signals of discomfort from different regions, a lack of function, therefore a lack of independent mobility, you start to suffer. And I think that's a really key thing to say. So now talking about how we can influence these different sources of pain, because I think everybody always goes, oh, it's to do with the cartilage, it's to do with bone on bone, and that's the only place it comes from. So if we just block that pathway, then we've dealt with it.
If that were true, huh? Wouldn't that be a nice thing? That would be super easy. Then this would be a great, easy disease to treat.
Yeah, we just plug every joint with some kind of really thick viscoelastic polymer and it's fine.
Every single one. It would be amazing. But here's the thing, is that it's so interactive. So one of the things that really, as owners, one of the things I think is really important to start doing is opening your eyes and even start taking videos of your dogs. I have, most of my clients know by now, like if something's changed, bring me a video. I want to see a video when they're not excited, scared, anxious, or whatever, to be here with me, which is going to mask everything, right? Because adrenaline's an amazing thing. So when your dog goes to the vet, try to have some videos of them in their natural environment doing what you're worried about, getting up off the floor or trying to get off the couch or walk up the stairs or just walk. And it gives your team a great way of really understanding. So I was talking about like moving like a gazelle earlier, right? Does your dog still move like a gazelle? If we're talking about a bulldog, they've never walked like a gazelle. So let's be clear, like that's a little bit different. But if you have this lovely Labrador or a Ridgeback or dogs that should be able to flow and they're not, we need to kind of get a little bit of perspective as to why that's happening and not happening.
Can I just pause? Just one thing that I want to say, and shoot me down if you want to. But let's just go back to bulldog, and let's just go back to the breeds that are conformationally different. I get really upset that people go, but he's always walked like that, so that's fine. And actually, let's be really honest, there's a big reason why many of them do have abnormal gait. It's unfortunately these breeds are predisposed to serious joint problems, spinal problems.
Yes.
And we shouldn't just assume because they're of a bulldog, be it a Frenchie, be it a pug, be it English bulldog, American bulldog, whatever, that, oh, well, that's just within the breed. I think we need to start really understanding that within the breed means that there's also potential problems. And I'm definitely seeing a lot more like French bulldogs that are having seriously bad spines.
Yes. Very bad spines.
Very bad signs. Very, very bad signs. So just remember that point, guys. Yes, Michelle's talking about different conformations will create different gait patterns, but there are some conformations that are really prone to problems, and that doesn't mean that you just ignore them. You still get them checked. Good job. Then continue.
So 100%. And that's the thing is, even, you know, that's why as an owner, it's so important to take video and then look back. Like, did my French bulldog move like this a year ago? Or has he changed? Because everybody goes, he's a bulldog. And I can tell you from being in the veterinary world for such a long time, you see a pug, a Frenchie, or a something with that is prone to issues, and you're like, oh, Frenchie back. You know, but that's where we often can get very complacent, and that's a big problem. So don't allow anyone, including yourself, to get complacent because of breed, like Hannah said. So being able to kind of go back in time and move forward and look at comparative views and go, wow, you know, a year ago, he looked very different to how he does now. I don't really remember him having that big roach in his back, that where he's kind of like all hunched over and he's growing these ginormous muscles in his lower back that everyone thinks are fat pads, which sometimes there's a little bit of fat there, but a lot of the time it's really just the muscles that are pulling that back end forward because the pelvis can't do what it needs to do because of something going on in that hind limb chain. So, you know, looking at your dog's gait and kind of just being able to check in and go, yeah, that looks a little weird. I should probably look at that, is a great place to start. And start feeling, you know, the body is specifically designed to be symmetrical. And that doesn't mean that we don't have a dominant side and there might be a little bit more muscle on one side than the other side, but you shouldn't have a vast amount of muscle on one side and nothing on the other. So, you know, put your hands on your dogs, get to cop a feel, you know, from the back to the front, to the inside, all over. So that
being chiropractic, am I outrageous to say this? If your dog starts to change the level of their back, if the conformation at stance, you can see it changing, get it checked. Because I think people need some really clear visual clues. And I was just thinking, if my owners were to take a photo of their dog in front of a white wall once a year when they were having their vaccinations done and look to see if the back keeps the same conformation of we're beginning to encroach, that I would imagine, and from my experience, my short life in this area, there's always a problem if you start to get that conformational change.
Absolutely. And I wouldn't even say just like, I would do a front, a side, and a back picture.
Amazing.
So that you can see what's starting to change. I mean, what's really interesting to me when I look at I was sitting in with my functional medicine vet, who's amazing, yesterday, and we were looking at a dog together, and, you know, the dog kept on pulling its one right front leg back all the time. And it had come in for hip dysplasia. And I was like, has anybody checked out that front limb? Because when he lay down, you could actually see that his whole one limb was shorter than the other on the right side. So then it's a chicken and egg situation. And at that point, it doesn't really matter, because you've got to kind of break the puzzle apart and start from the beginning. That, yes, we have diagnostically one thing, but that doesn't mean we don't have a whole bunch of other things that are contributing to the problem. Because dogs always work in a diagonal. They have four legs. So their right back works with their left front. Their left back works with their right front. So when we can't use our right back leg, our left forelimb is going to take the brunt of the pressure, because the pressure has to go somewhere. So it goes from the back end, it crosses over that spine, and that's why we start to see that roaching of the spine, especially at the thoracolumbar junction, in the between the mid and the lower back. And then it goes on to the forelimb. And then all of a sudden they're like, oh, this dog is so prone to arthritis because now he's got elbow arthritis. But it's not actually the disease as such that has caused it. It's actually the functional compensation. So it's the muscle and the weight sitting on a limb. So if we had to walk around doing handstands all day, our shoulders and our backs and our necks would be a hot mess. We wouldn't even be able to move, because it's not designed for that.
No, I agree. So now that people are beginning to kind of look globally at the dog, not globally, at the dog.
Globally.
I can do. So there's people that have gone, oh, they said hip arthritis. I'm going to listen to this because my dog's got hip arthritis. But this is everything. This is knee arthritis, hock arthritis, digit arthritis, spinal, articular facet arthritis. There is always going to be a restriction that requires function to be pushed to another region. And the other region goes, I can cope for a while. Now you're taking the piss. I'm beginning to struggle. And so therefore, this opens the concept that you're not just treating the arthritic original joint. You've got other areas that you can treat. And now let's start talking about the tissue types and therefore the interventions that can work. Because people are going, yeah, this is really interesting, Hannah. What can we do? But before we can tell you what you can do, you need to understand the tissue that you're doing with. So can you please talk to people about this generalist term of soft tissue? Because people don't understand.
Okay, so from the beginning of any life, there is a system called the fascial system. And fascia is possibly one of the most important systems in our entire body, if not, for me, the most important.
Yes.
So fascia is, if you guys have ever eaten ribs, the white stuff that is really tight that you have to pull off the ribs before you can cook them, and it comes off almost as like one whole big kind of package, is the fascia. And fascia is amazing because it's the most structural and important tissue, because it holds things in place. It allows muscles to move. It makes them not adhere to skin and all this cool stuff. But what's important about fascia is that fascia, as it kind of develops, it grows into tendons, it grows into ligaments, and it grows into capsules, which holds everything together. And then muscle is the bulk, right? We've got the skeletal muscle, which is cool because you got type 1 and type 2 that lets you do different things with your body. But inevitably, they're all attached. They're surrounded by fascia. They attach via, we've got our ligaments and our tendons and our capsules that all interact with the muscular system. So everything works as a whole. It never, ever, ever works individually.
Yeah, and I'm going to just pause because people go and look in a book now, and I can remember how mental it was here to hear about the fascial system, because 20 years ago when I was at vet school, the anatomy books that you got didn't include it. It was not mentioned. So you got the impression as a potential surgeon that a joint had like band-aids around it. So that's the collateral ligament, and that's the long and that's the short collateral ligament. And you're like, oh, perfect. They'll just stand out like little band-aids on the side, like a little Meccano set. And you cut open the skin the first time, you go, I can't see them. And it's all blended. And I can remember thinking, God, this is incredible. This fascia just seeps into surrounding every nerve. It gets into the kidneys. It's everywhere. And if you were to remove all other tissue type and you're just left with fascia, you'd still have the perfect shape of a human and all the internal organs. That's nuts. So yes, continue.
And so when you're trying to affect one thing, one of the things that you need to remember is it's never one thing. You are never, ever, ever going to affect just one thing. So when your therapist says to you, okay, we're going to show you a stretch or an exercise like a bicycle for the hip, where you're going to get that mobility going, you're not just affecting the mobility of the hip joint, you're affecting all of the tissue around it. So you're going to affect the capsule within the hip. You're going to affect the fascia surrounding, like Hannah was saying, the nerves, the muscle, these ligaments, these tendons, the actual hip joint itself. It's all being affected. And you've got all these amazing sensory signals that are going to the brain, telling the brain constantly what is happening in that joint and how it feels, what the temperature is, where it is, where's its location, all these incredible things. So when you are doing anything, you're never just doing one thing. You're going to be affecting all of the joint and the bone and those sorts of things. But on top of it, you're going to be sending different signals and different kind of relationships to not only other muscles and other fascial components, but you're going to be sending from that particular joint. So it's going to be changing. And that is why it's important to understand the neural pathways, because every single thing we do in veterinary medicine, whether it's pharmaceutical or whether it's rehabilitative or chiropractic or laser or shockwave, our goal is the same. And it's really funny when you start to break down all of these mechanisms of action. So the way these machines are designed to work, and these exercises are meant to work, and the drug is meant to work, they all have exactly the same focus, which is to increase that dampening pathway and reduce the level of inflammation that is going on in that area and the signaling that it keeps on sending out. So it's almost like having a lighthouse that is constantly blaring every time that it's bad weather. And in an osteoarthritic joint, it's generally always bad weather.
Yeah, so, no, I like that. I'm going to use that. That's really good. So that the lighthouse light coming around once or twice, every 2 minutes, is now coming around all the time. That is an arthritic joint, and it's stimulus up to the brain. 100%. Love that.
So, when we're looking at interventions that you can do, your hands are always your most powerful tool. I really believe it, because like Hannah was saying, no one has, or well, some people do, but not everybody has has a therapist around them that can help them, or the money to do so, because this is a lifelong commitment. And before we go down that road too, about what we can do with our hands, the other thing that I would really encourage you to do is start looking at other points of inflammation that we might have overlooked, like, for example, the gut. We know that the gut in human medicine has been shown to be the center of everything. And we know this to be true in dogs too. So if we are feeding bad food, it doesn't matter how many COX inhibitors we stuff down our dogs' throats. It doesn't matter how much inflammation we try to quell from just a purely joint perspective. If we have inflammation that's going on in the gut and we haven't got that under control, that is what we call systemic inflammation. So that inflammation then goes everywhere. It's almost like having an abscessed tooth. We can do everything we like, but if there's infection or inflammation going through the body, whatever we're going to do is going to be a drop in the ocean.
I know we've had Cecilia Villaverde come in, and we started touching on the microbiome, and it's called the joint gut axis. And there's definitely exciting times ahead. I think for knowing what food groups and stuff, I think that is, the jury's still very out. And I know that what we're learning is that dogs are prone to different dogs are prone to different food groups. So being able to generically go, this is bad for this dog, is a bit like humans. Some humans do very well on high carb diets, and some humans do really well on high fat diets. But definitely having a healthy microbiome for the dog, and which is normally shown in, nice solid stools, not a huge amount of flatulence, not a huge amount of frequency, the perfect stool type is a really good indicator that a dog's got a good gut. But no, you're absolutely right. Trying to kind of look at the bigger picture is really, really important, very important. And it's, anybody that wants to look into it, it's called the joint gut axis, and it's beginning to take a lot of attention, definitely in the human sector. And actually, it wasn't long ago, I asked Cecilia to tell us what articles were yet released, and she was like, pretty minimal in the pet sector at the moment, but it's on its way. So this is exciting.
Well, and if you go onto the microbiome website, they have a lot of stuff about some of their products like Phytospore, and there's a whole bunch. They're a great company to keep an eye on. They're doing some fantastic research in the way of dogs. So yeah, if that's something to look at, but fantastic. But anyway, so moving on to what you can do is, I think get to know your dog's body is the most important thing first. So figure out normal so you can identify abnormal, and most muscle and fascia should be squishy. And it should be soft to the touch. It shouldn't be like bouncing a penny off the ground, that is so super hard and hypertonic, which means the muscle's got too much tone. It's almost just angry and stringy. So you should almost, if you palpate a muscle or fascia, you should be able to feel the joint underneath. So if we're feeling around the hip, you should be able to kind of go through the muscle and be able to feel the underlying bony layers. Same thing in the ribs, right? If you can just feel hardness, that is something that is not great. So then we've got to kind of figure out what works. Massage for most things is very safe. And it's a great way of bringing blood to the area. It's a great way of, touch is so important because it's part of these neural pathways. So you kind of get in there and you start to bring some more blood flow to the area. You start to release some toxins, which stimulates the lymphatic pathway that carries some of that gunk out, which is going to give it a huge reprieve. And it's able to actually chill out a little bit. So massage and learning to massage effectively is really a nice technique. Doing some stretches within the dog's capacity. And the reason why I say that is, like, we don't want to take a dog with hip dysplasia and crank its leg all the way back, because it can't get into that position. No matter how hard you try, all you're going to do is have your face bitten off, because homie don't move like that, right? It just doesn't go like that.
Oh, it's good you mentioned that, because I was just doing an examination of a dog in front of the owner the other day,
Mm-hmm.
and they watched me just use 2 fingers under the forearm just to see whether the dog was happy to flex its elbow. And I think they were quite surprised, but I was like, no, I want the dog to tell me whether it's happy to flex its elbows. Because if I grab and I push, I'm going to flex it whether it likes or not. I want to know whether it's happy to flex its elbows. And they're like, whoa, that's fascinating. Because dogs, at the end of the day, they're bloody lovely. You know, they're really, really kind souls. And we got to work with them. So yes, guys, don't go heavy on your passive range of motion. 2-finger rule. That sounds wrong, but it's 2-finger rule.
Well, and on that point, that's exactly what I talk about a lot is check strength. Strength tells us so much. So this is as simple as lifting one of your dog's legs at a time and seeing how easy it is. You know, theoretically, if we have our weight distributed on all 4 legs accordingly, like equally, we shouldn't be able to pick up a leg with 2 fingers. They should be pretty solid, but a lot of the time, because they're guarding and they are trying to take the weight off that painful limb, they'll lift it with 2 fingers, no problem.
Yeah, no, that's a really good point. And also, as you say, and it's especially, is it Trendelenburg, isn't it, where they're able to weight. And so if you pick up one back leg, the body should go, okay.
And it should be able to hold. It shouldn't drop. And that's the difference with Trendelenburgs, is the opposite side will drop because it actually can't sustain in a square position.
Yeah. There's loads of stuff that human physios do looking at function, which we don't have that so much in animals, because we can't ask them to consent to us doing a test. You know, hey, we're just going to flex your knee. We just want you to push back a little bit. See how far you can push. They'll be like, running. But anyway, we're circumventing the point. So back to these little beauties that are free of charge and they can be used at home. And we're trying to give people interventions and a global picture. Continue.
So, you know, as one of the techniques I love is skin rolling. Because again, we've got... we should theoretically, in most of our dogs, be able to pick away, and I say pick away, like grab a portion of the skin and pull it away from where it is, okay? Now, if the fascial system and there's so much inflammation going on in an area, it's going to get super tight, like we talked about before. In fact, some of the time you can even see little ripples on the skin where the fascia is dehydrated so much because of adhesions, which means it's got all sticky. It's got nasty and it's all stuck together and it's not allowing anything to move because of an inflammatory pathway or an injury in that area. So what you want to do is actually pull the skin a little bit and roll it like you were rolling a cigarette, okay? And roll it down the body and see if there's some points in your rolling that they get stuck. And you're like, oh, I'm going to have to leave it here and pick it up on the other side. And those little stuck points are little adhesions. Now, if you do a bit of skin rolling and some massage over those areas, you can actually start rehydrating that fascia and bringing blood back to that area and lymphatic flow back to that area and nutrition, and start actually curing that injury yourself.
If you'd said that to me 8 years ago, I'd be like, shut up. Because it's just not taught. And my little anecdotal story, I was being taught by a lady called Julia Robertson, and she was telling me about coat changes, and I was like, oh, shut up. As if, because I'm from a very Western-based university training that didn't accommodate that at all. And so the idea that the coat doesn't shed if there's fascial adhesions, or the coat colour might be different to other healthier parts of the body, or the pattern changes, for example. And unfortunately, one of my clients' dogs died a few months later, and she offered for me to have the body for dissection, which is incredible for an owner. I'm not saying everybody go and do that, but for me, it was like, wow, thank you. I haven't had the opportunity to dissect a dog since my first and second year at university. So this dog had a lot of clumping of the coat. So over the thoracic, the chest cavity, it was smooth and beautiful. And then over the thighs, clumpy coat. So when we went to lift the skin away so we could look at the underlying structures, me and Julia, over the chest, just peeled away beautifully. And as we chose to move the skin off the leg, and she just went, "Told you." And I was like, "Okay," but it's mind blowing. And yes, sometimes when treating animals, one of the things that owners will say is, "His coat's so much better. He's lost that scurf. You know, he's got the voice back." And you're like, "Well, at least I'm doing something." So,
yeah, and it's big. And that's why I say, we can't be so specific, like this is ABC. It's so much bigger than that. And, all of those things, from inflammatory markers in the gut to what's happening at an isolated level, they all play together. So, just starting with those sorts of things and, watching your dog, because, the one thing I get a lot is like, "Oh, but he loves to do that." I'm like, does he love that? Or does he just love that you love that he loves that? Because dogs are, like you say, they have no placebo. They are wonderful in temperament, and they just want to please you. Most of them, some not so much, but most of them just want to hang out with their buddy and have the best day. Like yesterday was my best day. Today is my best day. Yeah. Every day is my best day. Yeah. But, if you're saying, "Oh, they can walk a mile," can they really?
Yeah. Yeah. I definitely think, if people, knowing what I know now, all of these years later, I think giving people the confidence to observe and question. Yeah. And I think that's a really big thing. I think we're so busy nowadays, aren't we? On our mobile phones, we're rushing to this, that, and the other. And so many dogs would be attended to earlier if people observed and then felt comfortable enough to go and speak to a professional and say, "I've noticed this. Is it something to be concerned about?" Just going back to the skin rolling, just from my own experience, be very gentle. Look for very subtle indicators of "I'm not enjoying this." So it might just be widening of the eye. It might just be don't. It might be the ears go back slightly. It might just be a quick. It might be a slight shift. But many dogs are very, very polite, and they're saying, actually, it's a bit like when my mum was brushing my hair as a child. Start at the top and all the way down, and you're like, "Oh God," too scared of her to say anything. But I'd be like, so be gentle, be kind. Also, there's a very big difference between pinching and gently lifting. And if I went and grabbed a pinch of skin, you're going to get a reaction. If you gently lift a section of skin, that's a very different. I think a safe space to start and ask for consent would be over the chest cavity. Would that be probably the safest place to introduce the idea?
Or even, generally the scruff has a lot of skin in most dogs. So even just kind of, and it's this movement. It's a little roll. You're not doing, it's
you're not putting out the washing.
Yeah, exactly. So, just like the scruff is not a bad place just because it gives you a little bit of leeway. Yes. And remember that everywhere you go, it'll change the amount that you can pull. So that doesn't mean that it's super adhered in certain areas where there's tautness. So if you have a pit bull, for example, they're pretty hard to skin roll because their skin is so tight anywhere and their muscles are so developed. But, you'll be able to, once you start playing with it, and again, very gently, you'll be able to pick up on those nuances.
Yeah. Okay, so skin rolling is a nice intervention because it's going to stimulate the nervous system. It's going to start breaking down those fascial adhesions. It's going to potentially bring in blood flow, allow lymphatic drainage. It's a bonding experience for you and your dog. I think people forget how important. Like, I was away for a few days, and Luna is just like, she's left me, and now I'm back with her. She's like, yes, we're together again. And I think people forget that has a massive impact on their emotional and cognitive state. So don't forget that just spending time is also so precious to your dog. What about things like gentle effleurage? Explain to people about effleurage and where you might introduce it in a very safe way.
So effleurage is a very it's what we generally do like if you've ever been for a massage, it's the beginning and the end of the massage. So it's a very gentle, easy massage where you're not digging. We never dig. No poking. No
No
poking.
pokey.
It's a very gentle sliding type motion that you're going to use. And generally what you can do is go with the muscle or with the line that you're trying to affect. And it's not, in my view, I always say to people, no harder than how you can touch your eyeball.
Oh, that's a good one.
So however hard you can push your eyeball without having any pain or not seeing stars, that is how hard you are able to go. So that's a good gauge. You always need a gauge. You need a beacon, right? So that is really helpful. And again, like Hannah was saying, watch for those telltale signs. Are they uncomfortable? Are they giving you hairy eyeball? Are they moving away? You know, we've got to respect them as much as they try to respect us.
Yeah, definitely. And I think for me, when I'm trying to introduce a few of these kind of things into an owner's repertoire of what they're doing for the dog. So I run a pain clinics, and the people that come to see me generally are already committed to do the multimodal approach for their dog, and they want to contribute. So I've got the lovely Alison watching again, and we've been looking after her dog Daisy May, and Alison's like, give me stuff to do. My dog is my absolute love, and I want to change whatever's needed to do the best for my dog. So I teach massage techniques to many of my owners, and a good place I start is the neck, because quite often, mostly I don't tend to see too many neck problems. I don't have many wobblers on my case and cervical disc disease, or the one at the top, can't remember what it's called. So it's a good what?
Chiari malformation.
Yes, things like that. Chiari malformation, and the other one where the dens doesn't form properly, so they don't have a good articulation between cervical vertebrae 1 and 2. It goes on my head, but the neck is quite a big compensatory zone. It takes a lot of work. So bringing some effleurage down the neck from behind the ears, over the huge amount of muscle mass behind the ears, over that atlas, and bringing your effleurage down the neck, down to the shoulders, down into the pecs, just gently. It's very rarely I meet a dog that doesn't go, oh, thanks, how did you know?
And gentle is key.
Yes.
And you know there are some things that are that you can try with your dogs. Some dogs really like heat, so it could be a little bean bag that you put down for them. You see if they like it. If they don't like it, please don't ever make it hot. Warm is as hot as you're ever going to go, and make sure you don't ever burn them, because they will never forgive you. But you know, very often I find doing massage or something that is going to increase the blood flow first, and then doing stretches is important, because you don't really want to stretch something cold.
No.
So doing some massage, even doing a little bit of therapy, and that may be like walk over a pole to get those limbs up, whatever it may be, and then you go into your stretching, is way more important than trying to ever stretch something cold. Don't ever stretch something cold.
No. And I think I know, talking to a lot of physiotherapists, they're comfortable with massage, they're comfortable with skin rolling, as long as the owner's really taught about those cues of I'm not happy, back off. But I definitely hear over in the UK, passive range of motion and stretching people want it to be taught, I think, because I think there can be heavy-handedness. And so I tend to try and make sure people know how gentle to be and what they're allowed to do, and keep within that zone. Don't go too far, too harsh, because there is terrible tendency, and I don't know whether it was from the 1980s, no pain, no gain. That's rubbish. Explain to people why that is actually a ridiculous statement to bring into our world.
Well, especially because we have an inflammatory process already happening. We need to, dogs are guarding for a reason. They're being protective. So when you go past that protective pathway, and you're forcing them into a position that they cannot physically or do not physically want to be, what is going to happen is you're going to spark that inflammatory pathway and that pain pathway all over again.
Yeah, you're just going to drive what's already there. You're just going to make
You
it
poke
work.
the bear.
Yeah, and then you can have a dog that doesn't want to spend time with you.
Mm-hmm.
And this is all about keeping them for as long as possible in our care, in our companionship. You don't want them to start going, I don't want to hang out with you anymore.
And that's why actually one of my favorite things to do is active range of motion, because dogs generally will not put themselves in a position of pain if they can help it.
Yeah.
So if we're doing things like a cookie stretch,
Yeah.
the dog will only go as far as the dog can go. If we're pushing that neck past a point that they can generally go, that's going to end us and them in a bad position. But if you allow them to show you what their range of motion is, then you can work within the confines of that.
Yeah, definitely. I think the a mantra is choice. We need to make sure that our lovely friends have choice. Mm-hmm. So don't back them into a corner. So I always try and say to people, don't try and do them in the corner of the room. Mm-hmm. Give them exit points. They've got to feel that they are allowed to proactively choose. Mm-hmm. If you corner them, they're going to become inhibited. Yeah. Or even worse, they might actually say, not having this. So just think about where you're acting. Give them exit points. Make sure you're calm. We transfer so much tension in ourselves in the way we're breathing and posturing and we're approaching them. If you're on a bad day, don't you dare try this because you're going to get a bad result. But no, that's lovely. So let's kind of like just do a recap, and then we're going to do our 10 kind of top tips, because we know the 10 top tips is always what people hang around for. So let's do a synopsis, and you butt in. We need to consider that the arthritic joint is what we could call the primary, but there is an onion around there of other layers that we can intervene with. And therefore, we're going to impact our dog's overall pain state. So I quite often will draw a diagram and I'll go, hey, just fictitiously, there's 20% pain here, 30% there, 10% there, 5% up there. So let's do a bit of massage up there and let's do a bit down here. And suddenly we're down to 50%. And they're like, oh, wow, great, let's do that. So step outside of thinking that the pain is only within the joint and it can only be managed with pharmaceuticals. There are other ways. Think about the different kind of approaches. We've talked about manual therapy. We've talked about lifestyle change. We've talked about stretching, passive range of motion, active range of motion, appropriate exercise. I've talked about just being with your dog and how much they get out of that. So do think about these other ways that you can influence. I would strongly suggest, if you are able, spend a little bit of time with a physio or a chiropractic, osteopath, manual therapist. It is not money wasted. You will see the world in a different way, and it will give you your opportunity to really influence your dog's bigger picture. Can you add to that?
No, I 100% agree. I think the biggest thing is allow them to have an opinion. Less is always more. So always start lighter, slower than you think you should. Think about your eyeball all the time.
Eyeball, way forward with the eyeball.
And it's never just one thing. It is never, ever, 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 ever just one thing. It is always a multitude of things. And if you only have a hammer, everything looks like a nail. Yes. And that applies to your team too, is if you can have a multifactorial team with different strengths and different skill sets, that is going to put you in a very good stance where people coming in with different ways to shape that onion. So that's very, very important, is because for the practitioner too, if they only have one skill set, they're always going to try to manipulate their treatment plan to that skill set. Yeah. So make sure you have somebody with a vast amount of knowledge who can pick and choose different things, because that's why we have toolboxes, not a hammer.
Yes, I agree. I like that a lot. So we're going to do 10 top tips, but I'm going to take advantage first. Request number 1 is the people that are listening, please say thank you to Michele for having spent her valuable lunch hour with us. It is such an honor to spend time with you because you're just wonderful. So please tell me where you're listening from. It's always great to hear where we're reaching out to. Number 2, I just need to tell you guys that Cam is working very, very hard at the moment to have a bit of a global influence. We do practice training. So we go into your vet practice, no matter where you are in the world, and we train your receptionists, we train your vets and your veterinary nurses, all to start singing from the same song sheet. We're doing it online. So we've trained practices in Australia, New Zealand, Abu Dhabi. We are really pushing the CAM message out there because we're pursuing a CAM practice friendly status so that you owners can go onto our website and you can find practices that have got a CAM friendly status. It means that they've adapted their waiting room, they've got better kennel facilities, their nurses are trained, they've brought complementary therapies into their practice, they have a greater understanding about this disease. So help us do that by telling your practices that this exists. Right, now let's go on to our 10 top tips. I'm going to do number 10. That means number 1 is left for you, which means it's the best one, so it's got to be good. So number 10 from me is, please guys, be observant. Like, Luna's only 4 and I watch her move. I'm watching how she approaches things, whether she can jump up, jump down, if she's got a preference, which way she turns, what's her gait look like. Watch your dog move, how they posture, how they lay, how they sit, because the sooner you get an idea that something's going on, the sooner you can do something about it. Number 9.
Be part of the process. Be proactive. So get your hands on your dog, learn what is normal for them that day, and start recording.
I like that. Number 8 for me, photos. So the amazing Hannah Walker, who's one of our ambassadors, did a brilliant photo of her dog when carrying a bit of weight and then compared it to the dog not carrying that bit of weight in exactly the same context, in the same front of the same wall, the same lighting. Wow, you saw coat pattern changes, you saw head carriage, tail carriage, incredible. So take photos and videos of your dog because it's a really good way to spot change.
Number 7. Arthritic pain never miraculously goes away. So find the primary. And remember that there's always compensations. So don't get too caught in the primary. Treat holistically.
I like that. Number 6 for me, something that I've said a couple of times tonight, is that you can do so much just by being present. And I think people forget that these is a companion species. They really want to be with us. And if their mobility is starting to decline, they can't be with us so easily. So they become isolated. And then many people will say to me, oh, it's okay, he just sleeps all day. And I'm like, do you want to sleep all day? I wouldn't want to sleep all day. That means that I've been on my own all day. So a free of charge, amazing intervention is be with your dog. You know, sit, pet, touch, talk, bring leaves from the garden, get the licky mat out. You'll be utterly amazed at how much pain relief that brings. Number 5.
Emotion is related to pain. So if you start seeing a change in personality and a change in emotion and a change in a change in their normal, that is not normal. Investigate further.
Yep, I like that one. Number 4 goes out to everybody. Be you a therapist, be you a vet nurse, a vet, or an owner. Foot care drives me crazy. And the nurses that I work with find me annoying because I'll be supposed to be getting ready for surgery and supposed to be putting my cap on and scrubs, and I'm shaving fur between pads and clipping nails. And they're like, Hannah came in for a spay. I'm like, I don't care. I'm going to clip his feet. So that's number 4. Number 3, you've got to go. You've got someone waiting.
Number 3 would be stairs are not your dog's friend.
Yeah.
And if you have to do that, please make sure that you make allowances and you use things like help them up harnesses or something along those lines to help your friend do what they need to do.
I like that one a lot. I'm going to continue that one with our hashtag, more rugs, less drugs.
Yes.
And I just believe in that 100%. If I could have a carpet sales company, I bloody would. Please, 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 if it's the only thing you do is get traction down for your dogs, number one.
Don't be scared to be part of this journey.
Yeah.
And it's the least we could do.
Yeah, I love that. Definitely. We have a phrase that says, oh, we have it here actually. These are my original flyers from when I did my home service. Okay. And it basically says, arthritis isn't the end of the road. It's just the start of a new direction.
Exactly. And, you know, don't put all the responsibility on your vet. Take it by the reins and be part of the journey.
Love it. Amazing. Amazing. You're amazing. So thank you so much. I know you've got to get back to work.
Cool.
I'm really grateful for your time. And thank you guys for listening. Please spread the word loud and clear everywhere. And we will see you all next week. Take care.
Bye.